world where territory, financial aspects, inequalities, and globalization all impact health. Our society is rapidly and constantly changing, and so are its problems. This increases the need for faster, more specific, and complex solutions. As a result, public policy challenges have become increasingly complex. Can you imagine working with an evidence-based approach that considers government, academia, civil society, industry, and environmental factors to improve healthcare and policymaking? Well, in Brazil, this is becoming our reality. I am Rebeca Pedra from the VIP Natural Health Center at the University of São Paulo, and today I'm going to share with you 3 experiences of applying design thinking to evidence-based approaches in research and policymaking. Well, first of all, I must say, design thinking brings a human-centered perspective. It combines empathy, collaboration, and experimentation. It promotes solving complex problems by developing innovative solutions that are desirable, financially viable, and technologically feasible, all in an agile way. Well, our first experience applying design in research was building COVID and oral health inventory. We use design thinking to identify the challenges faced by dentists around the world. So we developed an inventory with these evidence-based solutions to inform decision making. We involved on this project. It was a co-creation project. Dentists, decision makers, and other stakeholders to validate both the problems we found and the solutions we had, ensuring our inventory would reflect the user needs and that it were user-friendly. Another experience that we are currently doing is the use of design thinking to map the Brazilian evidence ecosystem. We are doing this in collaboration with the Brazilian Coalition for Evidence. We are mapping the Brazilian evidence that is an ecosystem that is made up of multiple centers and initiatives. It often operates in an uncoordinated manner, leading to fragmented resources and efforts. So we are integrating design thinking into all phases of the process, focusing on identifying actors and their needs, involving them in the process, not only within the healthcare sector, but also across the social evidence ecosystem too. This approach might promote more effective and targeted public policies, allowing us for better resource use and aligning with SDGs, especially the 16, peace, justice, and strong institutions. Well, another experience that we are currently doing is the task force to fight dental cavities in São Paulo state. Well, dental cavities are the world's biggest non-communicable disease, impacting not only health but also education and economy, as is a global economic burden. So in Brazil, we are working on a large-scale implementation project with a huge team to combat dental cavities by joining forces with the health, education, and industry sectors to deliver minimal intervention dental care in schools. And in some cities, we have already achieved the cavity-free milestone in our targeted population in just 6 months of implementation. This is the power of combining evidence-based approaches with design thinking. So I must say, design evidence-based approaches allow us to move fast, go far, and achieve great results together. Thank you.